All right, let's talk about the NCLEX, right? The NCLEX. Now, at this point, you already know the particular exam you are taking, right? The RN or the PN. Now, these both exam, um, you can be taking one of them, right? Either the RN or the PN exam, but they both test the same what knowledge. They both test the same knowledge, right? The only difference is the fact that the same knowledge is tested in different what scope of practice, right? When a registered nurse can plan, or practical nurse we contribute, right? A practical nurse will contribute. Planning is for registered nurse, contributing is for PN. So you can see such format in your question. So registered nursing, practical nursing, testing the same knowledge but different scope of practice. Now, when you are preparing for the NCLEX exam, right? The first thing you want to know, right, is the content. That's the first thing you want to know. The content. Right. You want to know where's the content. The content, we have the content on the NCLEX test plan. Right. Next thing you want to know is how the NCLEX write the questions. Right. And how do you know how the NCLEX write the question? Is by using the what? The NCLEX past questions. Right. And last thing you want to know is how to decode, right? How to decode, analyze, understand, right? Let me use or understand the NCLEX, the NCLEX questions, right? You want to be able to know how do you understand. At this point, you need what? Oh, coach, right? To be able to break down the question, because you might be taking this NCLEX for the first time. You are not used to the exam, so you might not even know how to go about it. So if you have a coach, right, that have helped over 500 plus nursing students to pass the NCLEX exam in 85 questions, and you are interested in passing the NCLEX as well to in 85 questions, then great. You need a coach to do this part for you. You can easily get access to this part, but this is the part that make a lot of students fail the NCLEX exam every of the time, right? Now, but what you need to understand, right, about every NCLEX question, we have different NCLEX question format, right? We have different NCLEX question format, but the most common one is the stand alone, right? Whereby you have your question, then your answer keys 1, 2, 3, 4, right? Now, standalone question is what you know from different program question, but standalone, but you don't understand what standalone means when it comes to the NCLEX exam. On your NCLEX exam, every of your question from 85 to 150 question will come in three formats, be it selected, apply, standalone. They're going to come in three formats. You have the scenario, the it can either be the body as well to the stem, and you're going to have the answer key. Now I'm using standalone for example. Now standalone is the most popular question on your exam, so focus on that. Now you have the body of the question, you have the stem of the question, and these are your what? Answer keys, right? These are your answer keys, right? So you want to pay attention. The body of the question, right? This part of your question is not the question. Is what make the question. But the body is not the question. Instead, this is where you try to establish what? Your role, right? Now, the stem is the question. The stem is the question, right? So, the answer key, how do you use the answer key? A lot of students don't know how to utilize the answer key. The answer key, in order to utilize the answer key, the NCLEX just wants you to either say yes, no, maybe to each of these options. If you say yes, it means that you are saying that's the correct answer. If you say no, it means that you are eliminating that. If you say maybe, it means that you are saying I will come back to it, right? Maybe after looking at all the options, you will come back to it. Now, This is how NCLEX wants you to answer your question. Your NCLEX wants you to pay attention to number one option and then link it to the focus, right? Or the knowledge statement. Let me just call it KS, knowledge statement, in that particular question. Because every question on the NCLEX exam comes from what? The NCLEX test plan. The test plan have 8 categories, and each of these categories has outlined the content, the knowledge that will be tested in each question. Now, if you are familiar with the test plan, you can easily see a particular NCLEX question and be able to think about it and say, okay, this question is testing about this. Immediately you know that the question is testing about that. Now, apply your yes, no, maybe. Now, ask yourself, is number one a solution to this knowledge statement? If it is yes, then that will be your correct answer. If it is no, that you eliminate. If it's maybe, you might just say maybe. Do the same thing maybe. If this is no, then you know this is out. This is no, this is out. Then you come back, you think about this and look at it. Which one is more related? You also pay attention to the stem to see why 1 and 2 you are in between. Then the stem, there might be a keyword that might separate or give you a clear decision. You say, 2 is the correct answer. That's how the NCLEX wants you to answer the question. You see, when I'm answering the question, I'm relating each option to the focus of the question. I am not thinking outside the question. Like a lot of students read the question and start thinking what is on their textbook, what is on their bootcamp, their U-word, their Asha. No, all the knowledge, all the information you need is already on that single question. The NCLEX just wants you to do just this to the question. Now, if you are thinking outside your question, it means that you are doing what? You are over thinking. So you need to be familiar with the NCLEX test plan. Now, another thing I want you to know is that we said the NCLEX RN, PN, the both are based on what? Scope of practice. Now, remember your 85 to 150 question. We test you as the nurse. The NCLEX is not testing you as the doctor. So stop thinking about diagnosis in your question. Now, the NCLEX might tell you, a patient is shaking, sweating, right? Having sweating, let's say confusion. Automatically, you are saying, okay, maybe the patient is having let me say it like hypoglycemia. Right? You said patient is having what? Hypoglycemia. That's what you are instantly thinking because of the symptom. Now, this is wrong. Don't do that. This is wrong. The NCLEX give you the symptom for a certain reason. The NCLEX don't want you to diagnose the condition. Instead, the NCLEX is only trying to tell you, based on concepts, what would you do when you have just what? Symptoms. That's what the NCLEX is trying to tell you. What would you do when you have just symptoms? So this is what the NCLEX is just only trying to tell you. Now, when you have, just like now, a patient presents to the unit, right, with what? Sign and symptom. What do you do for the patient? Right? A patient presents maybe to the ER, right, with sign and symptom. What would you do for the patient? Obviously, you start with assessment. Then you can maybe create a diagnosis. You can start planning, intervening, then you evaluate, right? This is what you want to do. So this is concept. When a patient presents with symptom, you either do assessment first on the NCLEX exam or intervention. The NCLEX is all about assessment, intervention, assessment, intervention, assessment, intervention, right? The NCLEX is all about evaluation as well, but you will see more of evaluation question too on the NCLEX exam. We are going to come back to this later, but the NCLEX is all about AIE. Right, I call it assessment, intervention, evaluation. There's more of evaluation question on the exam, less of assessment and less of evaluation. There are more of intervention question on the exam. So when you see symptoms, don't diagnose. You're wasting your time thinking about diagnosis. Some students will pay attention to trying to figure out what is the diagnosis. Because they have not been able to find out what is the diagnosis, they will not move on to answer the question. Now, when your NCLEX give you sign and symptom, right? We know we either want to do assessment or what? Intervention, right? But you need to pay attention to the keyword in that question. The NCLEX might tell you what is priority for you to do. The NCLEX might tell you what should you do first, right? When the NCLEX talk about first, it means they either want you to follow a certain step if the question is all about a procedure, which in this case, this is not a procedure. right? This is a symptom. It's a procedure. They might say urinary catheter, right? So this is a procedure, but this is a caring situation, emergency situation. So we cannot follow step which will lead to which involve in the procedure. We need to follow what? Nursing process, right? Nursing process, because the nursing process will solve a patient situation, not procedure, right? Now, nursing process, you need to follow what? Your assessment, but based on this is what we are thinking: assessment, intervention, right? That's what you need to follow. Assessment, intervention. Now, in this case, you want to pay attention to it. Now, you want to also focus on what? You want to focus on the patient's sign and symptom. If I tell you a patient is having shortness of breath, the patient is having chest pain, the patient is having 90/50 blood pressure reading, this is a life-threatening situation. Will I do assessment first for this situation? No. I cannot do assessment. I need to move to intervention because this is a life-threatening situation. So now, on your NCLEX exam, if you have a life-threatening situation, we skip assessment, we move straight to intervention. When the patient is stable, we come back to do what? Assessment. Right. So that's how you navigate. You might be faced with such kind of question. You need to think about it. Is it a life-threatening situation? If it's not a life-threatening situation, assess first. But if it's a life-threatening situation, you skip assessment, you go straight to what? Intervention. Right. So priority, what priority means is that if the NCLEX is asking you about priority on the NCLEX exam, what priority means is that the NCLEX will give you different options, right? 4 options. Everything are all correct. But the NCLEX is just trying to tell you which of these 4 options will be the number one priority. Right, everything are correct, but the NCLEX is just telling, okay, let me just say more than one answer is correct. Let me say more than one answer is correct, because some of the time maybe they might add one distractor and then 3 will be correct, 2 might be correct. You might have 2 correct answer, 3 correct answer. Not all the time 4, but some of the time 4. But you can never, if an NCLEX asks you for priority, you cannot see one answer on that question. You see more than one answer. You just need to decide which is priority based on the patient's situation at that moment. Now, a lot of people always used to ask, when do you call the healthcare provider? Now, let me tell you one secret now. On your NCLEX exam, you should not select any answer related to calling the healthcare provider when you have stand-alone question. Because the NCLEX is testing you strictly on your stand-alone question as a nurse. So, in every of your question, there's something you must do as a nurse. So if you see any answer related to healthcare provider, that's not the answer. But let me show you where you can select answer related to healthcare provider, right? Now, you can select answer related to healthcare provider in a standalone question, right? That is related to pharmacology, right? That is related to pharmacology. That is select all that apply. In this point, you have more than 4 answers. So calling the doctor will be part of the answer. Your case study, right? Your case study, your bow tie, your chart. Now, these are the areas. Right. Remember I said your standalone answer question, you should not select any answer related to calling the healthcare provider. But that I did a mistake. You can select related to only what? Pharmacology. But any other question not related to pharmacology, don't select healthcare provider. Only select related to what? Pharmacology. Select all that applies no standalone. Case studies no standalone, bow tie, and chart. So these are the areas you can select what? Any answer related to healthcare provider, and you always be right. Trust me, you will always be right 100% of the time. Right? So yes, that is that for this. Remember, the NCLEX is testing you as a nurse. So you need to know what? Your scope of practice in each question. Right? You need to know your scope of practice in each question. Now, let me give you a certain scenario. Now, a patient is being prepared for abdominal surgery. Now, what I see a lot of students do is that they start thinking about the abdominal surgery. Oh, what should I remember about abdominal surgery? What did they teach me in school about abdominal surgery? We haven't seen it in any program that they said something about abdominal surgery. Whereas in reality, your scope of practice will not allow you to think anything related to abdominal surgery. Now, on your NCLEX test plan, which give you the plan of the exam, stated that they are going to test you on pre-op care and what? Post-op care, and then the last thing, monitoring for, let me just write it like this. The NCLEX want to test you on pre-op, post-op, and then monitoring for what? Complication. So this is what the NCLEX want to test you about. This when it comes to any surgery. So anytime you are seeing any question that have surgery on your NCLEX exam, never think about the surgery. That's not your scope of practice. What the NCLEX just want to test you is pre-op care, post-op care, complication. Now, the NCLEX will group answers from these three areas when it comes to select order apply question. Meaning, from this surgical question, right, you can either select an answer related to pre-op care, post-op care, or complication in a select order apply question. But when it comes to standalone question, whereby you just have the question, right, you have your four answers, then the question might be specific to either pre-op, post-op, or monitoring for complication. Now, the NCLEX might just say, oh, a patient returned from surgery. Which of the following findings require immediate follow-up? Is because there might be a complication. Now, a patient returned from surgery. A nurse is teaching a patient who returned from surgery. Which of the following statement by the patient require immediate intervention or reteaching post-op care? Now, a patient is being admitted for surgery and a nurse is preparing a patient for surgery. What's the NCLEX testing you? Admitted for the surgery. What you are going to do then is pre-op care. So by this simple explanation, you can easily navigate your surgical type question. So never think about the surgery. The surgery has nothing to do with you. Just focus on what? Pre-op, post-op, and complication. This is what is within your what? Your scope of practice, right? There are more things I will introduce you to when you come to the NCLEX, where it's more of understanding the NCLEX. But the last thing I'm going to share with you right here is that there are 6 ways the NCLEX write the question. But one thing, before I talk about the 6 ways, let us introduce ourselves to the 8th category. On the NCLEX exam, we have 8 categories, right? We have the 8 categories, right? So now, each of these categories have their content, right? Like for the let's do the NCLEX RN. Now for the NCLEX RN, we have management of care. I'm just going to put it in short. Management of care. We have safety and infection control. We have health promotion. We have psychosocial, right? Psychosocial. We have basic care and comfort. We have reduction of risk. We have pharmacology, and we have physiological adaptation. So 1, 2, 3, 4, 5, 6, 7, 8. So this is 8. Now for the PN, right? For the PN, the only thing that is changing is this, the first one, right? Which is coordination of care, right? Coordination of care. So that's what is just changing for the PN, right? Because you don't manage care, you coordinate it, right? So that's just the difference. Now, each of these category, right, be it the management of care or coordinating care, right, they have their listed content, right? Questions that will be tested under here, question that will be tested here, same for this, same for everything. The question that will be tested under each of the category, the NCLEX has stated it on the test plan, and each of those category, the NCLEX has stated how many questions you are going to get from each of those category. Now, I see people reading some areas that just have 9% question, 10% question for an exam that have 100% question. So you're only studying 9%, 10% of 85 question or 150 question. So how would you pass the NCLEX exam when you just know 9-10% knowledge for the exam? It's not possible. You are not going to pass. But if you look at the NCLEX test plan, right? You will be able to see those areas that have the most question in the exam, right? You're going to say, okay, this particular area is 18% of the exam, this is 12% of the exam, this is 16% of the exam, and be reading towards those areas, because those areas um shows up more on the NCLEX, show up more on the NCLEX exam. So you need to be paying attention to those areas, right? So on the test plan, you'll be able to get that, right? The NCLEX test plan. The NCLEX have the test plan for registered nurses and then for practical nurses. Now, this is how the NCLEX writes each question. There are six ways the NCLEX write the question, 6 ways. Now, let me start stating this. Now, the first one is that the NCLEX will be written in form of caring, right? The second one, the NCLEX will be written in form of what? Clinical judgment. The NCLEX will be written in form of clinical judgment. The NCLEX will be written in form of communication and documentation, right? The NCLEX will also be written in form of culture and spirituality, right? The NCLEX will also be written in form of nursing process, right? Nursing process. The NCLEX will also be written in form of what? Teaching or learning, right? Or learning. Now, the moment you are seeing a particular question, the NCLEX is saying the nurse is communicating with so person, that's a communication question. The nurse is caring for planning care, that's a care question. Your clinical judgment question is your case study. Now, documentation, what's the right way to document this? That's your documentation question. The aspect of adding their culture and spirituality to their care, that's those kind of questions. The nursing process, whereby the NCLEX is telling you which is priority, what would you do first, those are nursing process questions. The aspect the NCLEX is telling you, you attended a specific teaching, or you are teaching the patient about so, what's the understanding, or what is the staff understanding, that's the teaching and the learning type question. Right? We see this a lot, but we don't pay attention because we don't know how the question is being tested. Now, if it's a caring question, you will know. If it's a clinical judgment question, you will know. If it's a communication question, you will know. If it's a documentation question, you will know. If it's a culture and spirituality question, you will know. If it's a nursing process question, you will know. If it's a teaching question, you will know. Right? Now, how will this add advantage to making you pass the NCLEX exam in 85 questions? This will add an advantage because now you know this is a caring question. You know how to answer a caring question, right? I'm not going to talk about how to answer a caring question right here. Clinical judgment, you know. Communication, you know. Culture and spirituality, you know. Nursing process, you know. Teaching, you know. Because when the question is very rich, you can easily say this is a communication question. This is a documentation question. So you are going to answer that question based on the concept of these areas. Okay, 1, 2, 3, 4, 5, 6. This is areas, right? 6 way, right? Once you can be able to master this concept, you are going to beat the exam. I'm telling you, you are definitely going to beat the exam. Now, next session, I'm going to make sure we break down some certain questions whereby you know what is a caring question, a clinical judgment question, communication, documentation question, right? Culture spirituality question, nursing process question, teaching and learning question, so you can see sample of the question. But the important thing you should learn today is that the NCLEX, right, set the question from what? The NCLEX set the question from the NCLEX test plan, right? That's what you should know today. So you need to go and get the NCLEX test plan so that you can be able to, right, utilize the NCLEX test plan, right? If you don't have it, get it. If you have it, start utilizing it. Start studying it. If you are studying the registered nursing, studying to pass the registered nursing exam, get the test plan for the registered nursing. If you are studying to pass the PN exam, get the test plan for the practical nursing. So it's as simple. Cover your category so that when you go on the NCLEX exam, when you see any question on the exam, you can identify the question. You can easily say, this particular question, right? You can easily say, oh, this question is a management of care question. Oh, this is a safety and infection control question. This is a physiological adaptation question. This is a health promotion question, because you already know that it's being tested from each of these categories. This way, you understand the exam, you are able to beat the exam. Now, the last part I'm going to leave you with is that in order to pass the NCLEX exam, you need three things, right? These things have helped more than 500 students, which I have coached in the past, pass the NCLEX exam in 85 questions, leaving only 2 students who pass in 86 questions and another student pass in 150 questions. This particular student passed in 86 questions, failed previous exam in 85 questions. This particular student failed previous exam in 150 questions. Overall, from this number, right, I have 80% of the students who repeated, right, the exam. And guess what? I've beaten the whole pass rate of the NCLEX because for the last 6 years, right, only 50% pass the NCLEX exam when they failed the NCLEX exam. Those repeated test taker, only 50% pass the NCLEX exam. And guess what? I've been able to make 80% pass the NCLEX exam in 85 questions out of 500 and just only 2 passing 86 and 150. So I've been able to beat that odd. Why? Because I know what I'm doing. That's the main reason why I want you to focus on everything that I am saying here, because this will make the exam very easy for you. It's not magic. It's not my secret. It's the secret the NCLEX has given out, right? You just need to pay attention to the categories and then study across, right? And then every category content, you need to pay attention to the fact that is it written in form of caring, clinical judgment, communication, documentation, culture, spirituality, nursing process, teaching or learning. That's how you want to answer those questions. You want to know, is it a caring question? What should I pay attention to? Clinical judgment, it's a case study. Communication, documentation, what should you pay attention? Culture, spirituality, what you pay attention to? Nursing process, what should you pay attention to? Teaching and learning, what should you pay attention to? And that's what we are going to be doing in our next video. If I have any more knowledge, I'm going to get back to my whiteboard in order to explain more things you need to know about the NCLEX. But for now, let me leave it at this particular area so that we can have more time to talk about other things you need to know for the NCLEX exam.